Yet another article comes out linking joint hypermobility in functional neurologic disorders. So, I've got to review this article. My name is Julie Hirschberg. I am a neurologic physical therapist. I am the owner and founder of re+active Therapy and Wellness. I'm here in the Los Angeles area. And I love to talk all things functional neurologic disorders. I love to talk all things hypermobility. And so do my friends and colleagues. So literally Memorial Day, one of them sent me this article and said, hey, you got to check this out. So of course I did. And here I am reviewing for you all. And by the way, if you have questions, if you have comments as we're going through, please put those in the comments here or after this is posted in the comments after the post. So let's talk about this article here. And I'm going to just share a little shot of it so that you can see it. It is free full text, by the way. I will put this video and a link to this in our newsletter this week. If you are a clinician, sign up at reactiveeducation.com. If you're a patient, sign up at reactivept.com. But this is the article. It was a short article, so a pretty easy read, except for the statistics. Let me just tell you, I had to look up things to figure out the statistics. So, and I consider myself a little bit of a statistics nerd. These were things I had never heard of in this study, but it is a great little study to read. So joint hypermobility in functional neurologic disorder, a cross-sectional study. And this was a group that included folks from Australia as well as Virginia. So awesome. And as a cross-sectional study, what they looked at is they surveyed people with functional neurologic disorders and screened for joint hypermobility and for depression and anxiety. And what they were really looking to do was to see how these were interrelated, which makes sense because these are things that we can see at the same time, and we kind of want to know how they're interrelated. So that's exactly what they did in this study. And they put out an ask for people to complete a survey, and I think they got, let me just look at this. So I have it up behind our screen here, 215 people with functional neurologic disorders. So that's great. It's a pretty large group of people with FND. And what they did is they asked the people with FND to share the survey with people without FND. So 22 people who were probably friends and family contacts of the person with FND also filled out the survey. So they could have a group of people with FND and have a control group and look at the differences there. So pretty simple design, right? Send out a survey. What were the measures that they used? So they use, and I want to get it correct because it's called the 5PQ, but that 5 is 5-part joint hypermobility questionnaire, or the 5PQ, and it asks questions. So by the way, you could use this anytime. It asks questions. Can you or could you ever place your hands flat on the floor without bending your knees? Can you now or could you ever bend your thumb to touch your forearm? Clearly you can see that I cannot do that. That's number 2. As a child, this is one of the questions. As a child, did you amuse your friends by contorting your body into strange shapes, or could you do the splits? That's question 3. Question 4, as a child or teenager, did your kneecap or shoulder dislocate on more than one occasion? And then number 5, do you consider yourself double jointed? So this has been studied quite a bit, and a score of 2 or more on this scale has a 85% sensitivity and specificity for joint hypermobility. Now, this isn't the Baton scale. This isn't diagnosing somebody with a hypermobility syndrome or EDS, but it's just a screen. So that's how they screened that. And then they looked for depression with the PHQ-9, which is also really commonly used scale. That's what we also use at re+active. That's what I've used in research over and over again. And then the GAD-7 for screening for anxiety. And both of those also have scores that kind of tip somebody over. So for example, a score of 10 or above on the GAD-7 has an 89% sensitivity and 82% specificity for anxiety. And similarly, a 10 on the PHQ-9, I think a 10 or above, also has a high sensitivity and specificity for depression. So these are measures that have been used quite widely to look at the presence of these in all humans, to be honest. So what I want to show you here, now that I can share things, and I hope this, well, it doesn't show up super well, but this, as always with any study, I want to know who's included. What do these people look like? Are they like the people that I am treating? And here you can see a big breakdown of the group with FND and then the control group, their age, and then it goes gender, which, by the way, I'm going to have to do a follow-up review of another article that this group specified, which was the prevalence of gender, non-binary, and transgender folks with FND. And they cited that study. It just came out in 2024 and I haven't seen it. So, but by the way, you can see here that there's 7, so 3% of the population here, 0 in the control group. You can also see their ethnic breakdown. And then you can, well, you probably can't see it, but it's at the bottom. You can see their scores on the scale. And most importantly, so let's see if I can stop sharing that. Most importantly, what they found is that in this survey of people with functional neurologic disorders, there was a higher percentage of folks who screened positive for joint hypermobility. In fact, let me get the exact number, 74.4% screened positive. And it was 45.5% of people in controls, which is in the control group, which is also a high number, right? So, newsflash, hypermobility is not a rare disorder or a rare finding in people, but definitely more common in people with FND. What they also found is that in general, the folks with functional neurologic disorders had a higher rate of depression. That's also not a super surprising finding. That's been found in other studies. And that's not limited to FND. That's really common in all neurologic disorders, that there's a higher level of depression because it's hard to live your life with a neurologic disorder, and it can be, it can lead to feelings of depression. What they did not find was a difference in anxiety from the group with FND to the control group. So that did not significantly differ between the groups. Both groups had some anxiety. It was 44% of the group with FND and 22% of the group with the control group. Now you might say that sounds different, and it does. It is different, but it's not statistically different. Those maybe are not too surprising. Now here is the tricky, I'm going to call it tricky, statistics part of the paper that I'm going to be honest, I had to like look up this Johnson-Neiman interval, which is what they did, because I had never heard of that. And so I'm not going to do a statistics lesson in looking at the outcomes of this study. But what they were trying to do is a multiple regression, a linear regression, where basically the reason you would do this is you're trying to see how are these related to each other, hypermobility, FND, depression, anxiety. Could one predict the other? And could we create a model that helps in that prediction? That's what this type of statistic can do. And what they found is that hypermobility can predict FND. Now, this doesn't mean that we could kind of plug in an equation and go, well, if you have this level of hypermobility, it means you're going to get FND. But this would be the start in trying to understand, particularly joint hypermobility would be something that a person had from childhood. Whereas, so when we think of chicken or egg, right? So the questions on the 5PQ are actually kind of about childhood and lifelong hypermobility. The questions for anxiety and depression are now, and a lot of people with neurologic disorders and functional neurologic disorder would have anxiety and depression now because they have a functional neurologic disorder. However, it is possible that, and very likely, they had the joint hypermobility prior to the functional neurologic disorder. And could that help us understand maybe one of the factors that might contribute to the development of the functional neurologic disorder? This is so fascinating to me because we see people with hypermobility. We see people with functional neurologic disorders. We see people with both. And I'm asking myself this question all of the time. Is it that, and the authors talk about this in the discussion as well, is it that the kiddo with hypermobility, the person who has had this lifelong, has altered joint proprioception throughout their life. And this is providing incorrect feedback to the brain about where your body is in space. Is it the decreased joint stability, making a person feel very unsafe in their body, or causing some brain fog symptoms because of the extra demand that the brain has to take on to stabilize the body? These are questions I'm asking myself all of the time. Could it be due to some difficulties with interoception because of the hypermobility and potentially connective tissue disorder as well? Could it be due to the autonomic dysfunction that can occur in the presence of joint hypermobility? And could that autonomic dysfunction predispose or be part of the picture that contributes to a functional neurologic disorder? We don't know, but it's certainly this study. So this is the third study that I've reviewed with this looking at hypermobility or hypermobility syndromes or EDS and FND, and looking at the links. And clinically, we see this all of the time. And we see that when we help somebody stabilize their joints, when we improve strength and proprioception, interoception, that their FND symptoms get better. That really means that we should be looking at this for everyone. Now, I see a question here, but I want to talk through. I was chatting with another of my fellow researchers here on Instagram, and we were talking about how much we love the limitations section in an article. And I always do, because I always think as I'm writing, I'm a natural skeptic, by the way. I read things and I go, I don't know about that. Like they might be overstating something. And by the time I get to the limitations section, I'm like ready. I'm ready to be like, yes, are you going to acknowledge these limitations? And one of the biggest limitations in a survey study is it's like an opt-in survey study. You see an advertisement for a study, a survey study on hypermobility and FND. Well, if you're hypermobile and have FND, you're probably going to do that study, right? So there's a bias. Maybe it is picking up a higher level of hypermobility because those were the people interested in the study. Possibly, yes. Same in there is a bias in the control group because this was just a survey that was shared to them by the person with FND and hypermobility. So that there's a selection bias there, right? So we have to consider that in any studies, there are always limitations. No study is perfect by any means. Okay, so, but a very interesting study, right? So I see some questions. Thank you. I love questions and I just love interacting with you all. So sunbeams and barefoot, which is so lovely. Thank you for being here. How do you know if you're hypermobile though? Great question. So you could do something like the 5-point questionnaire, which they did in this study. So I talked through the questions that they asked, which is the thumb to forearm question, the hands to the floor, the party tricks as a child. But you can also do the Baton scale. This is what we use. It was developed for Ehlers-Danlos syndrome or EDS. You could go, by the way, one of the best resources around is the Ehlers-Danlos Society. They have tons of resources. You could screen yourself. I would talk to your physical therapist or your primary doctor. A lot of the folks that we work with a rheumatologist who specializes in connective tissue disorders and hypermobility syndromes. So that I don't give a diagnosis. I'm a physical therapist. I don't diagnose, but I certainly screen and then send somebody to resources or a doctor that can give the diagnosis. But certainly if you're working with a physical therapist, they should be screening. All of them should be screening for this because we can help manage it and it probably will decrease symptoms. Stories of Sorrel. Why do you all have such a lovely names here on Instagram? I love it. Thank you for this. It's fascinating and very important from the perspectives of someone with FND who's about to be assessed for joint hypermobility. Oh, I'm so glad that you are getting the assessment. And I think, one, I'm glad you or your healthcare team advocated for that. And two, our world is getting slightly more knowledgeable about hypermobility and more physical therapists and occupational therapists and speech therapists and more are getting the understanding of it. And so I'm just going to wish you well on this journey. And I hope it gives you a lot of information. And part of, we often think about this kind of like, what were some of the predisposing pieces? What were some of the causes for a person's FND? Everybody's very different. There's not usually just one thing or one cause. But hypermobility might be a part of that picture. And particularly a lot of folks with hypermobility have also had some sort of dislocation or injury that could have been part of the onset of their FND as well. So I'm so glad that you're going to get that checked out. And and continue to advocate not only for the diagnosis, but to get connected to a physical therapist, an occupational therapist, a chiropractor that really understands hypermobility and FND. So to have them both at the same time, to understand both of those, that's the like real win-win, and how those things interact. And then Some Beans and Barefoot also said the party tricks like, hey, I can pop my hip out kind of trick. Yeah. So sometimes it's like, hey, I can do the splits and pull my leg up to my ear, or hey, I can hyperextend my elbows here, or look what I can do with my fingers. Those are the kinds of things. I don't personally have any of those party tricks, but I grew up with people that did. And because I was a dancer, especially, I think a very bendy body can be highly successful in dance, but also suffer a lot of injuries in dance or gymnastics and things like that. So that is, again, one of the questions that they ask on the 5PQ for screening for hypermobility. So yes. So again, you could use those screening tools yourself. You could bring them to your clinical team and really see if this fits for you. Absolutely. And hi, Dr. Rachel Welch. In your personal professional experience, do you see HSD, so hypermobility syndromes, EDS, to be correlated more towards a particular type of FND? Ooh, that is a good question. We should do a study on that. Let me think here, because there are particular things that I have been noticing and I've been so curious about. And I don't think that I have seen a strong correlation between hypermobility and a type of FND. This is such a good question. Now I want to look at like all of our data, because we have a ton of data at re+active. So this is a very, very good searchable question that we could look at. Because we see it all. We see functional movement disorders. We see functional sensory disorders. We see functional seizures. We see 3PD. Functional cognitive disorders, and I will say across the board, we see hypermobility in all of those. Now, something that I do think I have seen more commonly is functional paralysis with hypermobility. So a functional weakness with hypermobility. Now, this one, well, they all kind of make sense to me. I'm going to be really honest, because when we think about the brain, so this is the like why we would even think these could be even connected, right? When I think about the brain, I think about it as a very predictive mechanism. So it makes predictions about how I would move, how my muscles would fire based on feedback loops. And when I think of functional weakness occurring, I often think of a sensory feedback loop being inaccurate and not properly giving some of those cues for muscles to fire. And so that I can see that occurring due to lack of proprioception or pain, because pain is so common in hypermobility. But I don't know for sure if that's more common. One thing I will say for sure is I used to really think, and I know many of my colleagues, fellow physical therapists, also thought that a physical therapist didn't have a large role in functional seizures or paroxysmal symptoms, meaning symptoms that come and go, and they might come to therapy and have no symptoms. And you might in physical therapy be like, what do we even do? Because you have no symptoms. We used to think there's nothing we could do. if you screen for the presence of hypermobility and dysautonomia and sensory deficits, they will absolutely be there, and they are very likely contributing to the paroxysmal symptoms, to the seizures, to the intermittent drop attacks, to intermittent dizziness. And I think, in the past, we just didn't know what to look for. Now we know we should be screening for hypermobility. We should be screening for POTS. We should be screening for sensory changes and doing things like a sensory profile and looking at sensory integration. So I do see the presence of those in functional seizures or intermittent symptoms, and that is exactly where we can intervene, and kind of exciting, to be honest. I'm thinking particularly of a person that we are working with right now, and we do an integrated interdisciplinary program with PT, OT, and psychology, and we base the frequency of those on a consultation with the person, and it's usually on Zoom, and how much of each discipline that person might need. And one of the people that just has intermittent seizures had physical therapy, but quite frankly, not enough. So we've increased it because as we did initial screens of things, we found that there were physical impairments like the hypermobility, there was autonomic pieces, there were other physical triggers around the neck and jaw that were really important contributors to the seizures. So this is my little plug for the role of physical therapy and screening the physical body, the sensory components, the autonomic, even in symptoms that come and go, even when the person is not having symptoms, because very likely there is also a physical component like the hypermobility. This study is showing it. And again, these are small studies. They have limitations, but there's been 2 other studies prior that looked at this and is finding this higher incidence of joint hypermobility in people with functional neurologic disorders. So good stuff, right? I think this is a very exciting time for research when it comes to FND and when it comes to hypermobility too. It's been hypermobility. No, it's not Hypermobility Awareness Month. It's EDS Awareness Month. And so we've been talking about this all month because we have a whole program, integrated program for people with zebra conditions. And it's something that we care very deeply about. So when this article popped up, I was like, it's perfect. All my favorite things all in one article. But it's just beginning. The research has just begun, and there's just so much more that we need to know and understand. But I just want to thank you for joining me on the journey of getting curious about this and asking questions and wanting to understand more deeply. So thank you for being here. And again, every week I put together our videos, our resources into a newsletter. I will send it out on Friday to clinicians, and I send it out on Monday to patients. If you comment newsletter, we'll actually send you the link to sign up. This is a free full text article that I reviewed today, so I'll send out the link to that as well. If you're already on our newsletter, thank you, and I will send it out this week. And I'm actually going to be on Friday in Nashville, Tennessee at an awesome multiple sclerosis conference and talking about the overlap of MS and FND. So I will be sure to share everything that I'm learning at that conference too. So stay tuned, and thank you. Thank you so much for being here and being curious with me. So I will talk to you soon, and have a good night.